I'm Michael Winship, the president of the Writers Guild of America East and a senior fellow at the think tank Demos. Welcome to all of you. How many of you are members of the Writers Guild? Some. Okay.
Some. Well, everyone welcome. The Writers Guild of America East is one of two writers guilds, the East and West. We are separately incorporated. We negotiate contracts together, but we are separate. We are affiliated with the AFL-CIO. We have 4,000 members east of the Mississippi, television, film, radio, new media. Our members include the people who write Daily Show, Colbert Report, Jimmy Fallon and Seth Meyers and new shows. Our members write Law and Order SVU and Nurse Jackie. Our members write CBS Evening News and World News Tonight and everything you hear on WINS 1010 WINS, All News. Phil Pilato is here tonight, one of our council members who works at WINS. So that's what we do. And one of the things that we do, in addition to the benefits that we offer our membership in terms of health and pension and residuals and so forth and so on, is to hold sessions like this. Over the last few years, we've held a number of sessions, the purpose of which is to educate our members and the general public on various issues and about various things. We've done these with the FBI. We've done them with the ATF, the Manhattan District Attorney's Office. We've done sessions on drone warfare. We've done sessions on sobriety and recovery. And tonight, Obamacare. And I am co-moderating tonight with my friend and colleague, Marty Kaplan. Marty is director of the Norman Lear Center at USC. He's also the Norman Lear Professor of Entertainment, Media, and Society there. And he is the principal investigator of Hollywood Health and Society. And I'm not sure what that means, Marty. Maybe you will tell us. But I also should say that Marty is a Writers Guild member, Writers Guild West. He has had a distinguished career as a screenwriter himself and has, like me, we have both worked as speechwriters. And he's also been a production executive, a studio executive. And I'm going to turn it over to Marty, but I first want to thank Marcia Seaman and Dana Weissman from our office, Nancy Hathorn, Jason Gordon, and I want to introduce our executive director, Lowell Peterson, who's in the back of the room. And now I'm going to toss it to Marty. Marty.
Thank you so much, Michael. We're thrilled to be here. The Hollywood Health and Society program of the Norman Lear Center has had a long partnership with the Writers Guild West. And the co-chair of our board, in fact, is ex officio the president of the Writers Guild West. And it's terrific that the president of the Writers Guild East is now on the board of that and that we are doing events together. So this is a terrific way to kick it off, and thank you so much for that. And I also want to thank the people who made this happen. We, in the end, just sort of take our chairs and do what the last stuff, everything that preceded this, in this case, Kate Folb, the director of Hollywood Health and Society, and Armine Kurian on the staff of Hollywood Health and Society, thanks to you as well. And in a moment, I'm going to introduce our panel. Just a word about Hollywood Health and Society. For 12 years now, what we have done with the help of grants from different agencies and philanthropies is to be a free resource to writers and producers in any part of the entertainment industry. Whenever they have a question that involves public health, we will put them in touch for free with the best experts anywhere on that topic. And so it's for shows that can't afford to have consultants, it's a way to be accurate if you want to be accurate. It's always, at the end of the conversation, up to the writer to decide, and the various parties that the writer's involved with, to decide whether or not and how it may or may not square with what an expert says. But we're happy to provide that, and public health for us includes everything that the Centers for Disease Control covers. That's our long-standing funder, and also climate change, which is a tremendously important public health issue, and access to health care, also a tremendously important issue, which is what brings us here this evening. So before introducing the panel, I thought it might be fun and informative just to kind of have a whirlwind tour of the way in which access to health care has been depicted in the media.
When I had insurance, I could get hit by a bus or catch on fire, you know? And it wouldn't matter. Now I gotta be careful?
Name and insurance, please.
Maggie Kent, and none.
All right, let's find her a room.
When a patient doesn't have insurance, you have to work around the system. First, you have to find someone who's recently died.
Cool, Mr. Rabinowitz just kicked it.
Hate him. Hate hospitals, William. That's why I keep voting for those death panels.
That's right, death panels. Big government's gonna decide whether you live or die. Oh, no.
Insurance?
Oh, yeah, check it. Definitely gonna want some of that.
You don't have insurance?
Why? How much is this gonna cost?
I have no idea, but x-rays alone could be a couple $100.
Yes, correct. If you can't afford it, the government will actually give you money to help pay for it.
Obamacare.
Yes, correct. If you're under 26, you can stay on your parents' insurance.
Obamacare.
Yes, correct. Anderson Cooper's giggle is adorable.
Shut up.
Yes, correct. Sandra Bullock's Lost in Space.
Shut up.
But he gets to have one of those waterproof casts so he can go in the pool, right?
Well, we'd have to get that approved by our newly assigned government healthcare liaison.
The people will not tolerate such bourgeois extravagance.
She takes seemingly impossible scandals and makes them go poof.
This is my son. He's out of college. He doesn't have any health insurance.
I thought you said this was a scandal. Under the Affordable Care Act, you'll stay under your parents' plan until you're 26.
Times are tough.
And it's not getting any easier now that Obamacare is extending our life expectancy. Let me die in an emergency room with a treatable disease like an American.
I'd like to use my Obamacare.
Oh, Obamacare? Why didn't you say so? Come right in.
What is the problem? We're all entitled to Obamacare. That's what that Rachel Maddow guy said.
I'll need more information than that.
Password Malia?
I have this friend, and he got sick. Like cancer sick. But because there wasn't Obamacare, he couldn't afford the treatments. So he was backed into a corner. You know what I mean?
And keep in mind, this man was a teacher with a family.
He was. So he did what any of us would have done. He started cooking meth.
You married a patient to give him insurance? If you lost your mind, insurance fraud is a serious offense.
Actually, according to the National Medical Anti-Fraud Association, it's not insurance fraud, it's just frowned upon.
It's highly unethical. You're a doctor, for God's sakes.
The medical community is fairly split on this. Is it more unethical to deny a patient life-saving care or to marry a patient and give him that care? It can get murky.
Don't you have somewhere to be, Dr. Gray?
It's his HMO. They're not going to cover that anymore.
Fucking Obamacare. What kind of a system we live in? You have to cripple yourself to stay alive.
Any idea how much it costs to insure a morbidly obese, alcoholic, diabetic woman with a heart murmur?
Is this your mom we're talking about?
HMO sending her home. And they took her friggin' legs. How am I supposed to take care of her? I got 2 jobs.
The product is good. The health insurance that's being provided is good. It's high quality and it's affordable.
Broken website and now cancellation notices from insurance companies, followed by sticker shock over higher prices for the new plans. It's directly at odds with repeated assurances from the president.
You've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
And because of Obamacare, they are not being able to keep it. To me, that is a lie.
Anyone peddling the notion that insurers are canceling people's plan without mentioning that almost all the insurers are encouraging people to join better plans with the same carrier and stronger benefits and stronger protections, if you leave that stuff out, you're being grossly misleading, to say the least.
Cavallaro's provider recently sent her this notice, reading, because of the requirements of the new laws, we can no longer offer your current policy.
All I want is what I currently have. I want to keep my doctors
and I would like to have lower premiums.
The insurance company is offering her a new plan that would cost $484 a month versus her current $293 premium, a 65% increase.
65% increase. That looks bad. That was a report from NBC Nightly News. But contributing editor for the American Prospect, Paul Waldman, saw the report and wanted to know what Cavallaros' other options might be. He did a little digging and discovered that by going on the California exchange, he got, quote, 9 different choices for a bronze plan. The average monthly cost was $258, or $35 a month less than what she's paying now for her bare bones plan. How common was it for health insurance companies to cancel policies in the individual market in a given year?
Oh, it's very, very common. In fact, it was one of the reasons I left the industry, just because of that practice.
This legislation is about creating jobs.
Breaking news for you, and it's coming from the Congressional Budget Office. They are the non-partisan government bean counters, so to speak. They say Obamacare will cost the economy in worker hours the equivalent of 2.3 million full-time jobs.
For all the media who, shot across the headlines this idea that somehow the Affordable Care Act was going to hurt jobs, I just want it to be very clear that the director of the Congressional Budget Office says for this year and the next couple of years, actually, it will help reduce unemployment. More people who are looking for work will find work as a result of the Affordable Care Act.
That channel you point to is, in fact, something that we think spurs employment and would reduce unemployment over the next few years.
Right. Unfortunately, misrepresentations go around the world 3 times before the truth begins to catch up, but maybe it will begin to catch up at this point.
So, affordable care, comedy, drama, and reality. We're talking about storytelling, really. The Writers Guild West has a big flag outside their headquarters that says America's Storytellers. So we are fortunate tonight to have 3 storytellers who approach the story of affordable health care from different and complementary vantage points. Julie, and I'm going to ask you to welcome them after I introduce all of them. Julie Bataille has been a communicator, a spokesperson in the public realm and the nonprofit realm, working for Dick Riley at the Department of Education, for Al Gore as vice president and as a presidential candidate, Georgetown University, and now for the agency at the Department of Health and Human Services, the Centers for Medicare and Medicaid System Services. And so she is the director of the Office of Communication there. Wendell Potter, whom you saw in that video and probably have seen in many news venues, is the former head of communication for CIGNA, one of the nation's largest health insurers. But he started out as a journalist, so he has that perspective as well. And he spent between Humana and CIGNA 15 years inside the insurance industry. 2 books of his I wanted to mention, which kind of encapsulate his recent journey. Deadly Spin, an insurance company insider, speaks out on how corporate PR is killing healthcare and deceiving Americans. And now a new book called Obamacare, What's in It for Me? So the public and nonprofit sector, then the impression of an insider in corporate communication, and now journalism. Trudy Lieberman has a base now at the Columbia Journalism Review, but she's worked for places like Consumer Reports, The Nation, the Los Angeles Times, and she has been a journalist for 40 years, of which the last couple of decades have focused on health insurance, access to health care. One of her books is called Slanting the Story, The Forces That Shape the News. We were going to have another panelist, unfortunately, Liz Flahive is a new mother, and sometimes things with new mothers are unpredictable, and tonight is one of those unpredictable events. And also, Michael Winship is a seasoned veteran of the news business, And so in some ways, and as president of the Writers Guild, he's also immersed in the world of storytellers. So please join me in welcoming our panel. So first question, and this is kind of a jump ball, maybe all of you or some of you want to talk about it. And by the way, at a certain point, we will welcome your questions and joining the conversation. So if you are an American who does not have health insurance, did not have health insurance, and what is the story you are being told about the Affordable Care Act? What do you think, from that perspective, is happening?
Well, I'll start. I think it depends on where you live, for one thing. I'm from Tennessee, and when I go back to visit family there, much of the news coverage is negative about the Affordable Care Act, much more than it is in Philadelphia, where I live now, and in other parts of the Northeast in particular. And I think that the culture of politics also makes a big difference in what you hear and what you believe about the Affordable Care Act. And even whether you hear it's called Obamacare or the Affordable Care Act will make some difference in how you perceive it or are willing to believe that there might be something in it for you. So I think there's so many variables. Where you hear it from and where you go to get your news and information. If you're a watcher, if you're a religious watcher of Fox News, that will mean that you have a certain opinion of it that someone who doesn't might not have.
Trudy?
Yeah, I think that the answer to the question really depends on what your political persuasion is. This law has been so politicized and so stretched by both sides or several sides in this whole debate. It's very difficult for anybody who really wants to find out what's going on to find out. I have a lot of people who do shopping for me at various exchanges because I need to have people on the ground so I can understand what's going on. One cannot really understand the Affordable Care Act sitting in Manhattan. And you need to find out what people are actually experiencing. And I think there are a lot of people who really do want health insurance, and they know they need it, and they know it's expensive. And I think one point that has been driven home through this whole process is that it's kind of dangerous to go without it. So I think starting from that premise, people think that they need it. They just don't know who to believe and where to turn. So I think if they tend to watch Fox, or they tend to be conservatives living in South Dakota, they may have one perspective about it and they're not very interested in going forward. If they're living in a more progressive area like Colorado, I think maybe they might be more inclined, but even that group of people is thinking that, gee, really what's in this for me? And then you've got another group of people who really do want to get covered, but have been running into incredible barriers even when the exchanges are working. And they are confronting a shopping decision and a policy that is incredibly difficult to understand.
So I would just echo my agreement with both panelists and say the story that we have been trying to tell from HHS and the department is not always the one that I think many people have read. But what we have really tried to do, and that will certainly get easier over time as more real people are benefiting from the law and different provisions of the law going into effect, are telling the stories of those individuals who are taking advantage of the new benefits. And certainly the law passed. There was an enormous political conversation that frankly confused some people and turned other people off of it altogether. And a lot of the early provisions of the law that went into effect, in particular, benefited senior citizens, things like better prices for prescription drugs, some Medicare benefits in particular. So we did a lot of educational efforts around that. And then certainly this fall with the launch of the new marketplaces, this is an enormous opportunity for millions of Americans to access coverage that they never had. but I think really trying to be specific with people about the benefits and how it can impact them and what it means for them, and having people who are like them, whether it's people in their peer group or their family network or something, that gives them a reason to trust information and then check it out and find sources of information, is really what I think will be more useful over time. I mean, think about health insurance and what you know about buying health insurance. It's a serious product. People take it very seriously, but we have seen an enormous demand for the product and hunger for information, and our ongoing work will be to make sure that we can give that to people in a way that they understand.
Julie, how would you measure the reality against your initial expectations going in?
You mean the reality of
how
sort
it's
of
going, how it's going as opposed
So,
to your expectations?
Yeah, I would certainly say, last week was certainly a good week for us in being able to announce that more than 3 million Americans since October now have coverage because of the marketplaces. We certainly expect and want millions more to enroll by the end of open enrollment, which is the end of March this year. Clearly, we were all very disappointed with the rollout itself in terms of the initial technical problems on the federal website, healthcare.gov. But we think a lot of that has been addressed. We are seeing, the vast majority of people who come to the site now being able to go through. But I think you still have to recognize what people are doing when they are seeking information about health insurance and coverage. And that is often something that they are looking for information on. Again, what does it mean for them in terms of their family budget? Is my doctor in the particular network or plan that I may choose? And it's something that they are likely going to make a decision on over, multiple days or weeks before they make their final decision. So we want to be able to give people that information so that they can make an informed decision in the time that they need to.
Trudy.
Well, before we leave this thought, I want to make it clear from my vantage point that I don't think people understand the law. And I don't think the explanations of why certain things in the law had to be in there have been clear, made understandable. And that's a very different process than telling somebody that they can stay on their parents' policy until they're 26. So they are getting these snippets of information about what this might do for you without any actual understanding. I'm going to give you an example of something I was writing today. I was writing a response to a woman who went on Fox News a few weeks ago complaining about the narrow network problem, but also complaining about the fact that she had to drop she got her policy canceled and now has to get a new one. And her doctors aren't in it, but what's more, she doesn't understand why she had to do this. And I thought, as I responded to her, what was really necessary is for her to understand on some level why those minimum benefits were in those new policies, what kind of cross-subsidization that this law, and there is some cross-subsidization and some wealth redistribution in this law, whether you really want to acknowledge that or not. A lot of people don't want to think about it, but there is. And I think that those concepts are not really very American. We don't know very much about them, and they're demonized. But it's my belief that unless people understand that, you're going to have more Deborah Cavalleros getting on TV. And so my plea to CMS and to everybody else who's explaining this is go beyond the superficial that, yeah, you can stay on your parents' policy or you can get a subsidized benefit, but to generate more understanding of the law. And I think that I've written 750 posts. And in many of those posts, I have made a plea to my fellow reporters, urging them to explain Obamacare in much greater detail.
Wendell, you said that Obamacare is so complicated it will make your hair hurt, which is a metaphor I understand in the abstract.
Right. Because it is such a complicated bill, it does a lot. And the reason it is big and complicated is we have a very big and complicated healthcare system with so many problems. And if you can't really solve one in isolation. You have to try to address a lot at one time, which the Affordable Care Act does. because of that complexity, it is very, very difficult for the media to try to figure out the best way to explain it. And many of them just simply do not even try. And Trudy can certainly attest to that, and so can I. And I do the same, I don't do this exactly the same kind of writing that Trudy does, but I also try to provide context and some explanation of the law. But the media, the public is not being well served by the media largely because I think a lot of reporters and certainly editors and producers just think that the public can't understand it, and it would take too much effort to try to explain it, and you can't do it in a soundbite. That's why the opposition has been so successful. You can call it a government takeover of health care. You can say that it contains death panels, which of course it doesn't, and it's not a government takeover. You can dismiss something, and I know this from my years working on the other side. You can defame something with a soundbite, but you have it's much more challenging to provide the appropriate context and content when something is complex.
So, Julie, is there an impossible task ahead of you?
I don't want to say anything is impossible. I think that the law is certainly complex, but I don't think writing about the law for the law's sake is really what's also going to benefit the consumer in the end. And I think making it digestible, Trudy, I take your points, and I think we can always do better in terms of making things more consumer friendly, but explaining provisions so that people understand what it means, I do think is something that will be increasingly important. And I also go back to what I said earlier, where if people can see individual examples of those who have benefited, it will start to be meaningful in a way that is much more tangible than I think a lot of the conversation has been to date. If you think about the law writ large as the law, you know, there are many, many provisions within it, but fundamentally it's about access, increasing access to healthcare in a number of different ways, and then driving down costs in the system. So anybody who wants to have a conversation about delivery system reform, we might do that another day, but all of those things really do have to work together in order to, over time, change the healthcare system. And that is something that we will continue to explain to people, but it will have to be in a way that individuals can understand what it means for them. And it's going to mean different things for different people depending on where they are at different stages in their own lives.
I think Trudy wanted to jump in.
Yeah, I just want to make the point that it's a very complex law and it's a very big, sprawling law, but it's, as Ted Marmer likes to point out, it's a patch, and it's a patch on America's patchwork quilt of health insurance. It was never meant to be national health insurance or anything really grand. That was never really in the cards. And at its core, it was a way to bring insurance to people who did not have it, people in the individual market, primarily, and the pre-existing conditions problem, and the expansion of Medicaid. And we know that that's only been a half a loaf at this point. And so I think when we talk about the ACA and what it does and doesn't do, it's very helpful to think about what it is in the larger context and who it is intended to help. And it is intended to help primarily people who don't have very much money. And I think we kind of, don't like to do that very much in this country. And I think, though, that we have to think about who this law is intended to help if we're really going to make a difference in trying to educate them.
So the stories that writers may want to tell through the vehicle of scripted entertainment would, to some degree, focus on those people who are poorer, who are not insured, so that those characters would be drawn from those ranks.
I think yes, but not exclusively. The approach I took when I wrote Obamacare, What's in It for Me, What Everyone Needs to Know About the Affordable Care Act, is using myself and my own immediate family and told stories about how the law affects each one of us. How it affects me as someone who's 62 and who left a job and frankly was dependent on my wife continuing to work because that's where we got our health insurance. And if she didn't have it, I probably wouldn't be doing what I'm doing right now because of job lock. And I explained that, but also using, telling the story of my wife, but also my daughter, who was able to go back on our policy until she turned 26. And my son, who his policy was not renewed long before the Affordable Care Act went into effect. So I explained how the practice has been, as I mentioned in that clip you saw, of the insurance industry for many, many years of deciding not to continue to offer policies, and in some cases kicking people out or raising their premiums so much that they're not eligible for their, or if they can't afford their policies. But also, I wrote about my cousins in Tennessee who don't make as much money as a lot of folks do, who live in small towns where there are no large employers, and the rates of insurance have been particularly high. My Tea Party cousins. So it affects every one of us. And one of the points I'd like to make is that it was written largely for those who are, I think, low to moderate income folks who just cannot afford coverage or can't get it because of a previous illness. They've been blackballed by the insurance industry in the past. But it absolutely affects and benefits every single one of us because it changes the rules and regulations for how health insurance companies operate. They can no longer drop us from coverage. They can no longer refuse to sell us coverage because of a pre-existing condition. They can't blackball us anymore. So it affects me, and I wouldn't categorize myself as someone low income, but we all in this country largely were just a layoff away, as I've said, from being uninsured.
To answer your question, Marty, I think that another group of people that is sort of disenfranchised in this whole thing, and I don't know whether a screenwriter would be interested in this or not, but the people who are not eligible for Medicaid expansion in the states are totally left out. And there's been a dearth of coverage in the media about the plight of these people because they do not qualify for Obamacare. They're too poor to buy insurance on their own, and their state Medicaid programs in most cases do not offer benefits to childless adults. So they really have no options except maybe a local clinic where they can get care on a sliding scale. And I would love to see a lot more coverage of that issue because it's just been ignored.
How many states and how many people are we talking about?
25, Julie?
I think half the country has not expanded.
It splits along red and blue lines pretty clearly. Yeah. And I mean, if you look at the stories of some of these individuals, it's not their fault that their state has made a decision not to help them. And I would also just emphasize that the federal dollars to support that expansion is about 100% at certainly, for the beginning. So the fact that these states aren't taking up the offer to help their own citizens is something that certainly we're disappointed about, and we'd love to encourage people to change their mind.
Well, speaking of storytelling, Wendell, I have a vivid memory of you coming to meet with me and my boss, Bill Moyers, and our producer, Gail Abloh, when you were first. We had this secret meeting early in the morning when you came in with some of the documents from CIGNA and some of the information that you had to share. That in and of itself is a terrific story, but also I think the story of your own experience, what changed your mind, what brought you over into this area is a great story. If you could share that.
Yeah, and it was almost as if these things were meant to happen to, make me see things from a different perspective. And there were three things. I'll be brief, but it was in 2007. One was the expectation that I would play a significant role in essentially destroying Michael Moore's reputation as a filmmaker when the movie Sicko was coming out. The industry was very much afraid of what impact that film might have. So we engaged a public relations firm in Washington to develop a very sophisticated campaign to push Michael Moore off the cliff if it seemed as if his film was getting some traction and could really influence the the public discourse on healthcare reform. We knew that it was inevitable that during the next election, 2008, that healthcare was going to be a big issue, and if a Democrat won, very likely would be there would be legislation, and we wanted to make sure that that legislation would not be single payer, for example, and that was the big reason for doing that. And I actually flew from Philadelphia to Sacramento to see the first screening of the film in the U.S., so I would know how I would be defending my company, which was mentioned in the film, but also how to go after Michael Moore. About a month after that, I went back to Tennessee to visit family, and I picked up my hometown newspaper and read about something called the healthcare expedition that was being held about 50 miles from where I grew up. And I went there out of curiosity. John Edwards was still campaigning at that time and had stopped by, so he made the news from having gone to this thing. I'd never heard of a healthcare expedition or Remote Area Medical, which was putting it on. It's an organization that was started in 1985 to fly U.S. doctors to developing countries where there is no access to care. But the organization started getting calls from communities in the U.S., and now most of their expeditions are in this country because of the lack of access. And I went there not knowing, but for something drove me to go there and check it out. I was, at the time, having to write a white paper for my company about the problem of the uninsured, but the drafts kept coming back to me to change it. I was trying for this to be an honest portrayal of the problem of the uninsured, but the direction I got was de-emphasize that and talk about or write about the number of people who have insurance and like their insurance. And I just was becoming increasingly demoralized about what I was being asked to do. And when I went to Wise County, Virginia to see that expedition, I saw people who were standing in incredibly long lines, lined up, willing to stand in line all day to be able to get care that's being provided by a doctor or another caregiver, in barns and animal stalls. It was on a county fairgrounds. And it was just as if I was finally able to see something that I would not allow myself to see and was keeping a distance from, of the extent that people were having to go through to get care. And I realized at that moment that I was that could have been me if my circumstances had just been a little bit different. I could have been one of those people standing in those long lines. And I was, the job that I had as head of corporate communications for one of the biggest insurance companies and working with the industry, I was helping to perpetuate a system that was trying to, that was making it necessary for people to get care in that manner. Then a little bit later after that, I was having to handle what we referred to as a high-profile case in which my company had refused to authorize coverage for a transplant for a 17-year-old girl in Los Angeles whose doctors said needed to have this transplant. If she had it, chances are she would had a 65% chance of living at least 5 years. Those were that's what they do in these kinds of circumstances. But a medical director at my company, 2,500 miles away, after just reviewing some paper, decided that in his view, he didn't think it was medically appropriate. So the company denied coverage for that girl. It became a very huge PR nightmare for my company. I was on the front lines of defending the company. The company eventually caved, quite frankly, because of the pressure, because of the publicity, the bad publicity, and agreed to cover it under special circumstances. And but it came too late. By this time, so much time had passed that she died 5 hours after the company said that she could have the transplant. And when she died, I just couldn't keep doing it. I couldn't handle another high-profile case. I couldn't keep doing what I did. So it was a crisis of conscience. Sorry to be so long-winded, but it was. I really came to terms about what I was doing for a living, and I felt it was important for me to be honest about how these companies operate and what they do to earn what Wall Street, a few blocks from here, expects them to earn.
A very, very powerful story. Writers are looking for conflict and drama and characters. And I wanted to ask Julie and Trudy, you are real people, not characters, but you have been, in your various ways, in the whirlwind. And Trudy, people are trying to spin you one way or the other all the time.
Probably.
What, probably. What has it been like for you to be closely covering this issue and interacting with all the different forces involved and watching as finally reform is being rolled out?
Oh, that's an interesting question, actually. I'm a very thorough reporter and a very honest reporter, and I see things as they are, and I don't have, as Wendell knows, a lot of patience for spin from any side. I think about who I'm writing for, and I'm writing for, I guess, the people we're trying to reach with the Affordable Care Act, or the Medicare. I write a lot about Medicare. Medicare beneficiaries. They have a lot of challenges, too, ahead of them, as Julie knows. And I try to think about who I'm writing for. It's sort of like who the scriptwriter is writing for, that same kind of thing. And so if I think about that, that really helps me sort of think about what I need to know. And, you know, I'm not afraid to debunk one side or the other if they're just, you know, wrong or they're spinning. But that comes from a basis of really knowing a lot about healthcare, because I've been at it a very long time. But that's not to say I don't learn something new every single day. And that's what keeps me writing about Medicare after all of these years, and now the ACA, because it's really interesting. And, you know, I write for hours and hours and hours and hours about this stuff. And sometimes I say at the end of a very long day, I really think I've had enough of the Affordable Care Act for the day. But then at 7:30 the next morning, I'm ready to go again. And it's sort of the thrill of the chase, maybe, and just kind of understanding what new things I'm going to learn, like this whole business about narrow networks. In March, I didn't really think this was going to be a big issue, but it's turned out to be a huge issue. And people are really pissed about the narrow networks. And, you know, you can understand that. Nobody wants their surgeon to leave, you know, a month before an operation, or if you're in the middle of cancer treatment. So people are really pissed about this. And the reason for the narrow networks has never been explained to them. They don't understand why that is. And for me, I guess it's sort of like the journey that you had. You know, this is new. I mean, we hadn't written about narrow networks before. So the ACA is full of surprises and will continue to be so.
And Julie, you were expecting one narrative to be sending out, and then suddenly you had other stuff to handle.
Yes, that's every day in my office, I think, where the unexpected may happen. But I think, first of all, I haven't had a whole lot of time to reflect, and I'm not sure that's going to happen anytime soon. But I certainly think that when you look at, you know, what I'm doing and what my team is doing, it is really with a sense of mission and purpose in terms of helping people. And CMS, you know, traditionally has been a government agency that pays provider networks. You know, we pay the Medicare doctors, we manage Medicaid. So for us to launch the marketplace was a whole new series of opportunities, which we took on and are certainly excited about. And at the end of the day, while no one wanted the October that we had, I think I can't tell you the number of emails that I get from people who have, you know, unfortunately seen my name in the paper, who have a story, some good, some bad, and you know we've been able to help them. And we've had a lot of sleepless nights. I think that's probably going to continue for the foreseeable future. But they're now about, you know, ways that we can continue to help people and make a difference. And I think that, at the end of the day, is really what makes it all worth it.
If I could just do one quick follow-up on that. Tell me a little bit about those stories that you're hearing, and do you get those stories out?
So a couple of examples that I would share with you. I've had, several consumers who just email me with a particular situation that they've had on the website, a technical difficulty or glitch. And, for better or for worse, I know enough now about how the website works that I can sometimes tell them what to do or what little tip might work, and it helps them. But something that we've really made a concerted effort to do now is use social media in terms of helping people through our customer service channels. And we've had a number of individuals, and we've actually seen it more on Twitter than on Facebook, which I think is just interesting, where they have expressed legitimate frustration with whatever part of the process they're in, whether it's the site or needing information or our call center. And we've been able to continue a conversation with them and just point them in the right direction. And we've had a number of people follow up with us and just say, thank you, you really went the extra mile, or it's so nice to know there's people who really care. And I think, for us, certainly as a government agency launching social media channels, knowing we were going to have to serve people in a whole new way was something we took really seriously. And I think the team that we have doing this is really committed to it. So that's been something that's particularly interesting and especially gratifying when you see the consumer come full circle and we've been able to resolve their issue or, get their particular situation addressed.
I'd be curious how many people here have gone on the websites, have checked out either the federal site or the state sites. And
we're delighted to include you in the conversation. The one ground rule I would ask, please, is that you wait until a microphone gets to you.
Thank you for this informative discussion. I want to ask the panelists about some of the issues that, as I have watched the debate, have been left out of the original debate over the Affordable Care Act and definitely missing from the discussion of all the problems with the rollout and the complexities. And I want to focus on two. One is the question of two sides. It's always portrayed as there's Obamacare and there's the right-wing Republicans attacking Obamacare as being government intrusion. But there's a third position, which Wendell Potter has articulated, and you've been very courageous in explaining what is so fundamentally flawed about basing a healthcare system on a private for-profit insurance network that their profits depend on cutting back care. And therefore, at its best, Obamacare is just going to extend that flawed system to more people. But with the narrow networks and all the other restrictions we're seeing now, those problems are just going to persist and persist and persist. Whereas single payer would be universal coverage for everyone without any private profit being made, and much simpler because it would be one system for all. So that's my first question: is the exclusion of single payer or even the public option, which the Democrats allowed to be excluded from the bill, which could have prevented some of these problems. And then my second question is about the exclusion of not only undocumented immigrants, of which there are millions, as we all know, but even immigrants who've lived in the country for less than 5 years legally, quote unquote legally, they are also excluded from the Affordable Care Act. And so that's millions of people who will never get covered. So could you
single payer and immigrants.
I'm sorry. Single payer really didn't have much of a chance of being really heard on Capitol Hill for two or three reasons. One is because the insurance industry, which is so influential, was not really going to let it happen. But on the other end, other side of the spectrum, or the aisle, if you will, not really the aisle, but just advocacy groups, those who advocate for it, have not been very well organized either. And one of the things I've learned since I've been doing what I'm doing is advocacy groups generally don't understand strategy. They don't have the resources the other side has. So it just the deck was really stacked against any realistic or a reasonable hearing or debate about it. And so that was basically it. I think conceivably single payer could well, at the state level, and I've spent some time in Vermont, and Vermont is trying to move toward a single-payer system. It conceivably could happen in this country, but it likely would start at the state level like that. And it started that way in Canada at the provincial level. But the powers that be in Washington, it just wasn't going to happen. To another point you were making about immigrants, it's not likely that, well, it just wasn't going to happen either because it's such a contentious issue. But it's worth pointing out that in California, when the state, even when Arnold Schwarzenegger was governor, there was an understanding of the importance of bringing undocumented workers into coverage or into having access to care, and they were giving that serious consideration. The bill never passed, but it just gets so intertwined in partisan and ideological issues that it just can't get through Congress.
I'm going to add a couple things on the single payer or multi-payer issue, because you could have a national health insurance with multiple payers. And I think it's sort of a misnomer for us to think about having a national health system with only a single payer. Even in Canada, it's a multi-payer system because it's a provincial system, and every province has its own way of doing things. I think it's worth pointing out two things. One, the Affordable Care Act is really a Republican plan. And I think that most people do not understand this. The elements of the ACA, the subsidies, the tax subsidies, the individual mandate, the penalties for not buying insurance, were all Republican ideas. And they were also kind of mainstream ideas too. They were in the literature, the academic literature, in the early 1990s. And indeed, some of the Republican congressmen at the time were embracing these. And so I've always thought it kind of ironic that we've had this Republican plan and we've shut down the government because of Obamacare. So what gives here? And that contradiction has really never been explored in the media. And you can think about different scenarios about why that is so. I've heard it said that if the Republicans wanted to push this thing, they sort of foreclosed any chance that we would have a national health system anytime in the future because we're just sort of dealing with this right now. So that's one problem. The other problem is that the insurance companies are always the ones getting the blame here, and Lord knows they do things that are not necessarily what others would like to have happen, and they do things like Wendell has so ably documented. But I think we have to look at the medical community as well. The doctors in the hospitals and various other providers have never wanted any kind of national health care system. And in Canada, they only got it because the doctors in Saskatchewan lost a strike. And the medical societies up there are still pretty much in charge of what's going on there. There's some price negotiation with the provinces, but the societies are still pretty much in charge, which is why they also have an expensive system. We tend to forget that. And when you talk to some of the single-payer advocates who are largely doctors about this, they say, oh, no, it's not the doctors, it's the insurance companies. And one of the big contradictions in Obamacare that was never pointed out was if the insurance companies are so evil, then why are we bringing them 30 million new customers? That contradiction never really got explained. And so I think if we're ever going to have a different kind of system, we have to look at all the different stakeholder groups that might oppose it. And the insurance companies certainly would oppose it, but it goes far beyond the insurance companies.
Julie, do you want to comment on?
I would just say, I mean, clearly we're focused on implementing the law that is on the books. So as you can think about needing to explain that to consumers, that in and of itself is enough of a task for us right now. But we've certainly said as an administration that we'd be open to other changes if people have them and if things go through Congress. But I think our first task is making sure people understand what the law is, what it means for them, and what they can do as a result.
Spanish-speaking citizens or non-citizens are important to you, yes?
Very important. And as you think about the Latino community generally, Spanish-speaking or bilingual, if you look at their rates of heart disease, if you look at their rates of access to care and preventive services, this is something that disproportionately they often have problems with. So we have a huge concerted effort to make sure that Latinos in particular know the benefits of the law and take advantage of it. We have a lot of bilingual resources that are available for people. And I think, again, if you look at the states where the federal government is implementing the law, that there's certainly a need for us to be focused on the Latino community in particular.
Should we continue?
Whichever way.
Great. Who has the microphone? Armine? In the closer to you, and then you. Okay.
I was really struck when you talking about the ACA, how much you're focused on individualism, not just individuals, but individualism. Wanting to tell some particular person's story. Now, I understand it from the way that newspapers write and stuff like that, but really, as a public health issue, isn't it about more than individuals? And isn't there, I mean, this is part of what Trudy was referring to, isn't there another story besides individualism? I mean, people buy other kinds of insurance and they know that they are paying for something that they hope they're never going to have to use. You don't buy fire insurance because you want a fire, and that's the whole mechanism of insurance, if you will. And then the other thing that I'm struck by is that in talking about things like Medicaid expansion, it is a red-blue issue, but it's also a race and class issue. And you don't hear about that. You don't hear that the states that are refusing to expand Medicaid, I mean, nobody is saying, well, they don't want to insure Black people or other people of color. They don't want to insure poor people. They'd just as soon they died. And that's nothing new. And I'm surprised that, well, maybe I'm not surprised, but it's not reported. None of, and this, that frame is never put on it. And I'd just like you to comment about that.
Sure. So I have a couple of thoughts. One is when I talk about the individuals, what I'm really getting at is the notion of making the Affordable Care Act real for people. When you talk about the Affordable Care Act or you talk about Obamacare, a lot of what we've seen is that really makes people's eyes glaze over. And if you're really trying to get them to pay attention to how they can benefit and what's in it for them, it's giving them examples or stories of people that they can relate to. So there are many stories about the Affordable Care Act, individuals and on up, but that's what I'm really getting at, is how do you make this all real for people? So trying to do that in multiple ways is something that's been a part of our strategy. And to your other point, in terms of Medicaid expansion, what I would tell you is we have made a concerted effort to try to share census data that we have in terms of the individuals who are eligible for coverage, who would be able to benefit from Medicaid expansion, and show that at very granular breakdown points so that people can get the information that you're asking for in terms of race, in terms of ethnicity, in terms of socioeconomic status in particular. And you can see who would really benefit by being able to be covered under Medicaid expansion.
Anyone? Trudy?
Yeah, I think that Barbara's right on. And I think in the whole run-up to the ACA, there was never this discussion of the community that we're all in this together. We have to have a sharing of the risk. And I think I only saw one show that Bill Moyers did that got to that issue, and it had to do with Dick Cheney's heart attack. I don't know if he wrote that show. But it talked a lot about, here he was getting all this fabulous treatment because he was Dick Cheney. And it talked a little bit about the sort of communitarianism that we really should have been talking about, and it wasn't talked about. And you keep going back to why people don't understand it and why they don't understand this risk pooling that I talked about earlier. It's because we're not focusing on that. We're focusing on the individual. And I think until that changes, we will continue to have the system we have. We're never really going to change that very much. And as far as your statistics, I would really love to see them, if you would share them. Because I think Barbara's also right. I know a lot about the Midwestern states through another project I'm working on. And every time I know that they don't expand in those states, I keep thinking, it's got to be more than the governor's worried about money down the road. That's not the real answer.
Yeah, I'll give you those, and I'll tell you how much money they're turning down, too.
Do you think that's you talk about the individual versus the community. Do you think that's a broader issue in terms of society that we're dealing with? Because I write a lot about the when did citizens stop being citizens and become consumers? And
it's the way we think and the way we act in this country, the individualism and all that kind of stuff. We're always interested in helping someone build their barn up if the barn burns down. But, we're not necessarily going to give them some sort of federal program to help them. And I think that we're very schizophrenic as a country about that.
Well, and I think it goes to the point that you were making earlier, Trudy, in terms of who the Affordable Care Act was designed to benefit in the first place, and the fact that, the majority of Americans already have employer-sponsored coverage, and then there are other people who are already shopping and purchasing coverage on the individual market. So when you look at that, subset that's left, that's, roughly 15% of the population or something, that's really who we're having the conversation about in terms of access to coverage.
Yes. Here's it.
Hi. I have two quick points and a question. One is I just wanted to congratulate Mr. Wendell Potter for sharing his ethical dilemma as a member of the corporate. I'm sure that must have been difficult. Secondly, I wasn't on Wall Street, but I was at Zuccotti Park in its heyday at Occupy Wall Street as a filmmaker covering the different working groups. And I have to tell you that there was a very, very strong, well-organized, non-hippie, non-beatnik, doctors in white coats contingent, often protesting and conducting meetings. I haven't followed what's happened to them, but this gentleman here also knows some of them. So I have to disagree that there hasn't been a movement towards they called it an understandable, easy to understand single payer system. But then my question was, I sort of came here at the invitation of a friend, because I'm a member of the Authors Guild, but not the Writers Guild, and I'm a filmmaker. And I sort of wanted to know a bit more, although we saw your clips about how healthcare was being portrayed, I really haven't heard any further discussion of what you think would be, good scenarios. I mean, something like West Wing, only for healthcare, or something like Charlie Wilson's War that dealt with all the issues. I don't hear any discussion amongst the panelists of suggestions for how you think some of these issues. I know it's a complex and difficult subject, so especially for a panel. But maybe Mr. Kaplan has some comments on that issue.
Thank you for the question and for the comments as well. We are not proposing stories. What we're hoping to do is to convey the stories that are going on, the characters involved, the forces in conflict with one another, and then that's the raw material of writers. And it's up to writers, whether they're working on a show or dreaming up a pilot, it's up to them to be inspired by that or not. And which, if I might, leads me to a question. I mean, Wendell told an amazing, moving story. And I'd like to ask all three of you, and Michael, maybe you join in as well if you'd like. Tell us a great story. What's just an amazing story about someone and the Affordable Care Act?
I haven't got one about the Affordable Care Act specifically, but I've just been reading this new book, and sorry I can't come up with the title of the author, but about Patty Chayefsky and the creation of the movie Network. And a few years before Network, of course, Patty wrote an incredible movie called The Hospital, which was a devastating satire and indictment of the medical system in America with George C. Scott and a number of other wonderful actors. I feel like the time is ripe for an update.
I mean, some of the stories that I would share, go back to individuals, but I think you can look at it from a couple of different perspectives. There's certainly the provider, and I think looking at those people who are working in community health centers around the country who are seeing what it's like to deal with people who are uninsured on a regular basis, and now knowing how people can be impacted by having insurance and helping them get access to preventive care and things that they never had before is certainly one piece that is encouraging, and there's certainly places in the country where that's happening more than others just by virtue of what is there. And then the other that I would share is moms and the impact that they have on getting their children covered, whether it's not being able to get insurance for their child who has been very sick or had a pre-existing condition before, and now they're covered, they're able to have surgery. I think those are some of the most compelling stories that I have had, the ability to hear from people firsthand.
When you asked that, I was reminded of something that I was asked to speak on the one-year anniversary of the signing of the law in Denver, and I spoke on the Capitol steps, and in my remarks was talking about some of the benefits of the Affordable Care Act. And afterwards, a man who was about my age, I think he was a farmer, came up to me and said that he was confident. He thanked me for the work that I'd done on trying to get reform enacted. And it was not all that significant, the contribution I made, but he was telling me that he was confident that he was alive that day because of the Affordable Care Act. He had been deemed uninsurable by insurance companies because of pre-existing conditions. He could not buy coverage at any price. This was before, obviously, some of the more recent provisions went into effect, but he at least was able then to get coverage through the high-risk pool that was available to him, and the coverage was more affordable than it had been, and he was able to get coverage. And that moved me more than, I never forget that man, because that was a gentleman who was alive, and I'm confident he was telling me the truth, because of legislation the president had signed just a year before. And those kinds of stories can really be portrayed in a very compelling way, I think. And they are real. They are absolutely real. There are so many people who could not get access to coverage in this country because of the way the old system was. Trudy's right. The insurance industry certainly is by no means the only aspect of the healthcare system that is motivated by money. They all are, and that is at the heart, I think, of really what the problems really are is the profit factor. Whenever you're trying to, I don't want to get too far off on a tangent, but when you're undertaking change this significant, you're going to be affecting someone's income or someone's profit, and that's why it is so hard to affect this kind of change. But to pull this off, as flawed as this bill is, you're still saving countless lives.
Well, I want to talk about something beside the Affordable Care Act, but it's a health-related issue, and it's hunger among the elderly in this country. And it is an issue that I am passionate about and have written about for the nation, and it is being totally ignored by my brethren in the press. People need food to eat. Elders need food. They need food for health. It's the basic building block for good health. And what we have in this country are waiting lists for Meals on Wheels programs all over the country. Now, can you imagine an 82-year-old or an 85-year-old, number 400 on a waiting list in Louisiana or Indiana or wherever? They're all over. I investigated all of this for The Nation last year, wrote about it, talk about something that is so impactful and should not be happening in a country with the resources that the United States has. And a lot of people on Medicare are in this fix. This one man in Baltimore said to me that he did not have a supplement, a Medicare supplement. He couldn't afford it for him and his wife. And he had been on the meals program in Baltimore County, but he had to get off of it because they couldn't afford 2 meals. So, and his wife wasn't eating it anyway, so he was only on 1 meal. And several months later, the social worker went back there and found that he had also dropped his meal. And she asked him how he was managing. And he said, well, I do the best I can, but some days the best isn't good enough. And I think that this is something that is so basic. You can't, I mean, before you can even get to insurance, you have to have food. And every time I've mentioned this to people in the managed care industry and say, why don't you have these food programs? They say, oh, this isn't anything that we're interested in doing. So that is the one story that I think needs to be written and is not, or told, and is not being told.
I think it doesn't specifically deal with hunger in the elderly, but the documentary Place at the Table, I think, is if you have not seen that, is a terrific film about working families trying to cope with,
Well, these people can't work. They're elderly. They are. They're retired. They're the very old people, and we want people to live longer, right? But by taking all these medicines that
and part of this is all supposed to be about prevention.
Exactly.
And
well,
there
they're
seem
not
to be huge
preventing
gaps.
very much here.
No, exactly.
How about on this side?
While you're doing that, let me just comment that I didn't mean to imply that there is not significant support for single payer in this country. What I was trying to say was that while there is significant support, the advocates have not been.
You said they weren't very well organized.
No, I didn't mean to say that. They were not organized to in a way to be able to develop a strategic plan to move forward, and didn't have adequate financial resources. That was what I meant to say. If I said something other, I didn't mean to imply that they didn't have a great deal of enthusiasm, and that there were many people who are, but they have just not been able to overcome the opposition.
I'll send you my video.
Yeah. No, I don't disagree or even dispute what you're saying. My point was that the entrenched special interest is so powerful that they have been able to keep any discussion of single payer from really being that much of having a hearing on Capitol Hill. That was the point I was trying to make.
Yes.
I don't know if anyone on the panel could clarify, but
Speak up just a bit, so not for the mic, but for the room.
Well, I don't know if anyone can clarify on the panel, but I know that we talked about sort of the Medicaid expansion and those who are excluded, but also is there something happening within the exchanges, like in Louisiana, where the insurance providers are not accepting Ryan White funds and sort of pre-existing the whole clause that that you can't be denied, and how certain companies are sort of circumnavigating that.
Yeah, so I know that that's been an issue in terms of whether or not the Ryan White programs in particular would accept our funding. And you should know that we actually just put out guidance to clarify that in particular and make sure that folks know that they can use their federal grants to support that.
Can you explain what that is for people who don't know?
It's basically, you might be able to explain it better than I can. There's different government agencies that run different programs, but essentially the Ryan White program is a program that our sister agency runs to support people with HIV and AIDS, and there was a question about whether or not those providers would be able to use federal funds to help assist people who were getting coverage in the exchanges. And we just put out guidance to let people know that those programs are in fact eligible to use that funding as something called a third-party payer.
But are insurance providers required to accept the payments?
Well, Blue Cross in Louisiana is saying they're not going to accept it, and they're using it as a way to underwrite, and they don't want to insure people with HIV.
Trudy, I love it that you know what's going on everywhere.
Oh, I wrote a story about it this week.
Yes, in the back there.
Mr. Potter, I wanted to ask you a question about Betsy McGogie, and having dealt with her twice now from very different perspectives, I just wanted to find out your reaction to her. And also, I wanted Trudy to ask you about why the journalistic community has continuously, over 20 years, failed to take a look at her footnotes and look at what she's citing and how she cites those documents. She's the author of two basically Republican reports on why the Clinton healthcare plan and this healthcare plan, we fell for it twice. Both were no good. She is the author of the death penalty idea.
You're referring to the former Lieutenant Governor of New York, right? Yeah. Yeah. She has authored some things that have very little to do with reality, regrettably. But because she's been Lieutenant Governor and has been able to get on TV, a lot of people believe what she has to say. And she's not challenged nearly enough, in my view. She has been. A lot of her work has been disputed, and rightfully so. And you're right. I think she probably did coin the term death panels, and Sarah Palin picked up on it and began to use it. And she's usually the one who's cited as the person who coined it, but I think it was basically Bataille. I'll use that to make another point too, though, that I was going to make earlier, is that, and you're right, this is much about class as it is anything else, but one of the reasons why it is we're having this conversation today, why it is so contentious, is because it became a political issue from the very beginning. Just as the debate was starting on Capitol Hill, Frank Luntz wrote a memo to Republicans. He's a consultant and someone who is an expert in communications and linguistics, and he suggested, quite frankly, that anything that the Democrats came up with should be characterized as a government takeover of health care. And his point of view was that this could be a winning issue for the Republicans, and that they should stand against anything that the Democrats came up with. Interestingly, as Trudy noted, the law is built around Republican principles. The individual mandate, the exchanges are straight out of Republican policy and think tanks. But the Republicans were not willing to have anything to do with it for partisan reasons. And that began to take hold almost immediately, to the point now that there is, if you are identified with one political party, and if you are a conservative, you're not going to be persuaded to believe that it is anything other than the government takeover of health care. It was done very skillfully, with careful use of language, and it was political motivation. That is, in my view, why you have 25 states not expanding. It is because it is controlled by politicians who have been persuaded that to have anything to do with Obamacare, they wouldn't be conservative enough or Republican enough, and would be primaried if they even considered it.
Trudy, before you answer the question about why it's been like this, have you heard from the Democratic Party or from people who believe the Affordable Care Act is an important step in the nation? Have you heard a message which is the equivalent to government takeover?
I was just getting to that. Because we're equal opportunity discussion here. Let's just stipulate that the Democrats did the same thing that Frank Luntz did for the Republicans. They hired Celinda Lake. The money came from a group called the Herndon Alliance, which was convened in 2006, and the members were a whole bunch of people you would probably recognize. Many of the foundations, healthcare foundations, were part of this, but a lot of other organizations as well, labor organizations, church groups, and so on. So they hired Celinda Lake to kind of do for them that what Frank Luntz had done very successfully for the Republicans over 2 decades. And so Lake went out and did some polling, and she found, and it was all based on whatever values Americans had, and found that Americans didn't like the term single payer. They were really not interested in national health insurance, but they wanted affordable quality health care. So Celinda Lake wrote comparable memos to the one Luntz did, telling the Democrats that they need to refer to their endeavors at this point, there really wasn't any Obamacare at this point, as affordable quality health care. And if you think about that phrase and how it was used by supporters of the ACA, these people stayed on message, like probably even better than the Republicans. And you saw them use that phrase from the president, the secretary of HHS, on down to the grassroots people in Tennessee. And they didn't waver. And even at the very end of October, when the secretary was under a lot of fire for the website problems, she appeared on Sanjay Gupta's show, and I counted that she had used the term, or a variation of it, 8 times in the interview. So she was still using it at the end of October. And today they're still using it. You're going to get affordable quality health care. Well, that's come back to bite them, because we know that health care is not going to be affordable for certain segments of the population, and these are the ones you saw in the clips. So the interesting question for me is, why did it backfire a little bit on the Democrats and their supporters, but it hasn't backfired on Frank Luntz and his supporters? And I haven't figured that one out yet.
Julie, as long as we're talking about language.
I use affordable and quality many, many times a day. But I think it goes back to having people be able to articulate what that means for them. So as you look at affordable, that's a subjective determination that people make based on their own budgets. But the reality is, for people who have never been able to think that they could afford health coverage, now that they can get a subsidy, there are ways that they are paying very little for much better coverage than they ever could have gotten before. And I think that is what's helping people understand what this means.
What about the use of the word Obamacare?
It's interesting. I think it means different things to different people, but you certainly see us use it more now, and I think it's tangible in some cases for people. There are, moments where it's appropriate, and other times where it doesn't make sense to people. So I think it's something that gets used in context.
It was built up as a pejorative term by opposition. Was there a moment when a decision was made to use political jujitsu and say, okay, we're not going to resist, bring it on?
It's something, again, that in context has been what we've used from time to time. You certainly see us use it more when we are trying to insert humor or having conversations on social media, maybe conversations with young people, things like that. If you're looking at, our official website and information about how programs work and things like that, you wouldn't see it in that particular context.
You do see it on Two Broke Girls.
Yes.
My impression was that it was a decision that was made within the campaign in 2012. Was made within that group.
That would make sense.
Yeah.
Time for yes, Lowell.
I'm a little troubled by the insight that the Affordable Care Act is aimed, and the messaging is aimed at a relatively narrow swath of the population, people who don't have the resources maybe to get benefits through their employer. Certainly the Republican opposition to Medicaid expansion has affected this a great deal. But I think that the reason Social Security has withstood 50 years of onslaught is that it applies to a much broader range of the population. And I'm concerned that if we focus our discussion only on a relatively small number of people, this is going to be a very difficult political battle to win. I've been negotiating health benefits for 30 years in the labor movement. It's getting more and more difficult, and more people are dropping off of coverage, and coverage is getting worse and more expensive. And I think that was the driver behind getting the act passed. And that strikes me that maybe that could be part of the storyline more than it is.
I think it should be. And in fact, that's the point I try to make too. And the ultimate point I made with my ebook is that it affects and benefits every single one of us in ways that people are not realizing, because the media coverage has been on the rollout of the exchanges. And yeah, the exchanges really immediately affect a relatively small percentage of the population. But the law itself benefits every single one of us in one way or another, whether it, like I said earlier, most of us who have health insurance, even through our employer, there's no guarantee that we'll have that this time next week. You can lose your coverage at any time because you work at the pleasure of your employer usually, almost in all cases. And so if you lose your job, and over the years at CIGNA and Humana, I saw countless numbers of people laid off. I had to lay people off myself. And in many cases, you are putting them also in the ranks of the uninsured. Because even if they have the ability to get COBRA, it's so darn expensive that the take-up is minuscule. I think it's around 10% of people who are eligible for COBRA. So it benefits every one of us. You can no longer be turned down because of a pre-existing condition. That affects every single one of us. You can no longer lose your coverage because you get a diagnosis and the insurance company just would rather not pay for your coverage. So that was why I wrote the book as I did. Throughout our lives, regardless of how old you are or what your economic circumstances are, you are affected by this bill. It's not perfect by any means. And I think the story in the New York Times characterized me as someone who defends the Affordable Care Act. I've been a critic of it because it doesn't do things that it should have done, and as it was working its way through Congress, changes were made that troubled me. But it's important, and it does benefit us all.
Can I just answer your question about Social Security and Medicare? Because they are very different animals than the Affordable Care Act. We all have a stake in Social Security and Medicare because we have made contributions to those programs all through our working lives. We don't have that same kind of tie to the Affordable Care Act. And I think we have to go back to what Roosevelt said when Social Security was passed. With those damn contributions in there, nobody's going to scrap my Social Security plan. I mean, people have tried, and they're trying now, and it's not going very far.
Michael, do you have a last question for the
No, I think there was a question over here on the right.
Okay, that will be the last question. Yes.
Trudy, you had made the good point earlier that one thing a lot of people still need to understand is why there are subsidized benefits or free preventive services. And of course, sorry?
Say that, I didn't hear you.
That a lot of people don't understand why there are free preventive services and subsidized benefits. Of course, the Affordable Care Act is incredibly complex and covers a million different areas, but I was wondering, are there like 3 or 5 or 1 specific benefits that you would like to see come through in film and TV?
That's a hard question. I think the subsidies are very important to people. And I think if people understood how they worked and how they will work going forward, I think that would be a big step.
And I would just echo that in terms of the availability of there being a financial mechanism where people can get help affording the cost of a monthly premium. You know, when you throw out the terminology of how this works, subsidies and copays and deductibles, that is pretty complex for people to digest and understand. And this just isn't a subsidy. Oh, it's an advanced premium tax credit. Well, what does that mean to the average person? But boiling it down in a way that people understand, oh, I may not have to pay a $500 monthly premium. That means I may pay $25 or something, I think is enormously valuable to people, because that's really then giving them information so they can better understand how they could take advantage of that.
And I think Wendell's point about pre-existing condition is huge, huge, and needs to keep coming out more and more. It's really basic, but I think it strikes home.
Pre-existing conditions and gender.
And gender.
And gender, yeah.
As I sit here, you can't see it, but out that window on a building in huge super graphics is a sign which I don't know its origin, but what it says is, the French aristocracy never saw it coming either. And I wonder, as a last comment from any or all of you, that's about dramatic change. Do you foresee dramatic change either in any number of directions? The repeal and replace of the Affordable Care Act, or an evolution toward single payer of various kinds, or any other thing which is other than incremental?
I mean, from my perspective, I would just say what we're in the middle of right now is pretty historic change, in the fact that it's never happened. There is so many parts of the system that are changing in different ways all simultaneously. I think that in and of itself is what you're seeing, come about in the news stories that are being reported, for better or for worse. And I think it's certainly exciting to be a part of that. And as you see more people take advantage of the benefits, I think we'll start to see the real impacts of this too.
I agree. I think it is. I think our healthcare system is undergoing an evolution. I think the Affordable Care Act, in my view, sets things on a better course. I don't think that you'll see much more out of Washington. I think you'll see continued reform in some states that will be beneficial. In some states like Massachusetts, and I spent the past weekend in Vermont. I spent a lot of time there looking and talking with the folks who are pushing forward with a single payer system in Vermont. I think you will see things happen at the state level and in the private sector, which is an area I'm going to be focusing on some too, because the Affordable Care Act, I think, enables some changes in the private sector that it's going to be significant. And so we'll continue to see change. And I think you will see the industry that I came out of, significant change over time in health insurance in this country, partly because of the Affordable Care Act, partly because the system was not sustainable before the Affordable Care Act. I saw over 20 years how insurers changed radically, and I think we'll see that compressed in a shorter period of time. You'll see, I think in 5 years from now, a system that is hardly recognizable, and hopefully for the good.
I think it's way too early to say whether or to predict the demise of Obamacare. I think we need several years to let things kind of roll out. I do think there will be some changes to the law. I think the Democrats are already talking about this. CMS is even talking about some changes. And I think that we have to sort of see how some of these parts of the law get changed and whether they materially affect the basics of the law and the risk pooling and some of the subsidies and all of that. But anybody who says that it's dead is just really not, on the right track at this point. I mean, we don't know what's going to happen in 10 years. We don't have any crystal ball any more than the CBO does when they make their projections for 10 years. So we have to take those with a grain of salt too. But I think we have to just sort of watch it. and do our best. It's the law of the land, and we have to write about it, we have to talk about it, and try to get people to understand it.
Yeah, just to pick up from what Trudy said, that's why we've had this discussion, because it's the law of the land, and it's here, and we want our members and everybody else to have as much access to as much information as they can.
A perfect note on which to end. Thank you for your terrific questions. Please join me in thanking the panel.